think of diversity in terms of a lot of different things. Family composition, ethnicity, race, sexual orientation. Really, there's many different ways that we can be similar or different to people. Really what this movement ultimately should be striving for is to have equality in how we treat people regardless of how they're like us or not like us.
First of all, it's a patient safety issue. We need cultural competency now in our hospitals. We need to have patients understand the dynamics of their patient care and what that is all about. And we also know from the literature that when we understand the culture and we communicate in ways that the patient understands, the patient is more receptive on their discharge instructions on what they need to do to take care of themselves.
It's really been a culmination of forces in our society as well as the changing demographics in the United States. In 20 years, the face of this country is going to look decidedly different. I mean, we really have been able to recognize the disparities that exist in healthcare, and I think it's all coming to a head.
With the Nursing Workforce Diversity Initiative that we've been working on for a number of years now, a number of work groups met, and there was one group that worked on curriculum and staff development. And it was that group that came up with a definition of what cultural competence is and how broad it is, and had a lot of discussion about that. And that led to the idea that we really needed to do the awareness pieces, the cultural competence pieces, before we could really work on other avenues of diversifying the nursing workforce. Our goal is to reduce health disparities, but it's foundational to be culturally competent and culturally aware.
We really need to add diversity to our workforce, and the only way to do that is to make our nursing education and practice sites more culturally sensitive. Although healthcare isn't a high priority of the foundation, education is, however. We do believe that a healthy community and a strong healthcare workforce are key to everything else we do. I really researched it and started working with the nurses. I learned so much more about how healthcare that is not culturally sensitive can interfere with health outcomes.
So the purpose of all of this, of increasing the cultural competence of the nursing workforce, is to improve the care that clients and families receive in the healthcare system, and beyond that, to reduce healthcare disparities in our country. When we talk about cultural competence, we're really talking about the ability of the healthcare provider to step into the intercultural space and understand the differences that exist between themselves and the client that they're taking care of. One way for students to get into the intercultural space is to have a clinical experience. Another way for them to get into the intercultural space is through case studies that we might do in the classroom, and also into simulation.
The OCN definition of diversity has been really critical for us, because obviously we're looking at more than skin color and language. We're talking about so many different levels of diversity, including gender, sexual identity, religions, the list goes on. And something that has been so exciting about this project is as students started to hear more and more about diversity and cultural competency into the simulations, we started to have students approach us as content experts. For example, we had a student that asked whether or not we had considered integrating a transgendered patient into our simulation program. One of our faculty had already started to do that research. However, this student then became a content expert. She went on to share with us that her partner is transgendered and that she would be happy to share what it's like to be a family and in the healthcare system.
The key is to even recognize that that diversity exists, and that not everybody sees the world and shares the values and beliefs that we bring to the table, and to open up an honest communication so that we can acknowledge that those differences do exist and be able to talk about them. Right now, our staff represents somewhere between 25 and 30 different ethnicities, and that's part of the cultural diversity of our staff. Then you also need to take into consideration the differences in culture among generations, among genders, and even among socioeconomic lines, educational lines, and what part of the country you were raised in, or even what part of the city you were raised in. All of those are going to be part of the culture you bring to the workforce. A perfect world would be one that everybody could communicate, feel respected, feel valued, and where there was true collaboration and no feeling of hierarchy.
In a perfect world, we would have a nursing workforce that is culturally diverse, mirrors the population that we serve, be understanding, compassionate, smart, make good decisions, and help our citizens make good decisions, and I think we would have healthier people.
For clinicians to really change their practice, I think it's important for us to step back and take time to really look at what are some of the assumptions, what are some of the beliefs that we've been operating on, and to try to peel that back to where did that come from, where did we learn that, and then to be open to new knowledge, new information, again from research and from our colleagues. I think that's the way that we can really have practice changes that will be sustainable.
It really doesn't take that much to get to that point where people begin to understand just how big an issue this is.
The concept is not a new one. We have come to a different realization about its importance. I think the pendulum has swung way to biomedicine, and I think it's time to swing back. And I am so excited about the future of nursing because we are just right on the forefront of we have to do this. It's time.